Hello, um, my name is Cynthia Kando, and the topic about vaccine resistant malaria. Catholic University Nursing School. My name is Cynthia, Facebook Cynthia Kando 12@gmail.com. My teacher is Jaume Coso. Definition: the complete biology of Plasmodium falciparum has persisted major obstacles to the development of effective malaria vaccines, as in the basis throughout the stages of its life cycle. The malaria parasite expresses different stage-specific antigens, age stimulating and species immune response.
April marks one of the peaks of Kenya's malaria season, with Siaya district in the west currently the worst hit. 90% of patients admitted in the public referral hospital here show signs of malaria. Children are the most vulnerable. This is the equivalent of a high dependency unit where the most critically ill children go. Monica Odhiambo brought in her son who suffered a bout of malaria a week ago.
Where I come from, malaria is very common. Many children have died. Some, like mine, are brought to the hospital and survive, but others cannot be saved.
Monica's son is one beneficiary of a vaccination research program being carried out in poor rural communities in 11 sub-Saharan African countries. The program that aims to halve malaria infection is in its third and final phase. Optimism is high that the vaccine could be readily available on shelves by 2015.
Phase 2 trials were done elsewhere, they were not done here, and they found that it is effective, but it was in small groups of children. They found that it reduces malaria by 40%, severe malaria by 40%, and overall malaria by 50%. So children still got malaria, but it wasn't that frequent any longer. So that is a big achievement.
In this health center out in the countryside, Rosaline Atieno brings her 3-month-old twins. She has just enrolled in the vaccination program. Being a single mother with no job, she could not be happier. Her story resonates with many others in this region. Having watched her father and aunt die from malaria, she says she wants her children protected from the disease. 900 children below the age of 1 have so far been enrolled in the program, but children continue to die. A third of deaths of children under 5 here in Siaya are because of malaria. One of the biggest challenges facing those few rural health centers that people can actually access is that the required malaria medicine is more often than not unavailable.
Malaria becomes a major problem because when people don't access treatment in good time, then they end up with complications, and these complications are what lead to death. So one of the major issues we've had is with the supply of drugs to the health facilities.
Despite current control efforts, malaria still kills at least 1 million people globally every year, most of them children under 5 years. Kenya alone accounts for 36,000 child deaths annually, a figure that stakeholders hope to reduce by half by 2015. This, by all means, a tall order. Catherine Soy, Al Jazeera, Siaya, Western Kenya.
Application in nursing. Recombinase DNA vaccines seemingly outweigh the promise of welcoming energy diversity because, at least in theory, they are relatively simple to design and modify and have the potential to elicit productivity, immune resistance against multiple different antigens and different variety of antigens from different life stages of the parasite.
It is estimated that every 30 seconds a child somewhere in Africa dies of malaria. 34,000 children in Kenya alone lose their lives every year to a disease that has taken a toll on Africa's human and financial reaches. But that could change soon.
There is good evidence that a malaria vaccine is possible. There have been some very encouraging trials in the last few years.
The vaccine has already undergone 2 successful clinical trials, and phase 3 is almost complete, and it has been found to have a very promising safety profile. Africa is waiting, and researchers are racing to deliver the first vaccine before 2015. But scientists agree that the vaccine will not be a one-shot answer to defeating malaria.
One of the ways by which we can contain resistance is by using the ACTs. The ACTs, that is a combination of the artemisinin and another anti-malaria medicine.
When used correctly, ATCs are nearly 95% effective in curing malaria, and the parasite is highly unlikely to become drug resistant. So far, the drugs are not readily available in the market. Use of counterfeit drugs is also a major impediment to the war against malaria. It is estimated that a huge percentage of anti-malarial drugs in the Kenyan market have not been certified by the World Health Organization. Meanwhile, GlaxoSmithKline has launched a new pneumonia vaccine in the Kenyan market. The vaccine will be used by children aged between 6 weeks and 2 years against life-threatening diseases. Pneumonia kills more than 5,000 children every day. Sheila Sendeo, Citizen TV.
Pros cons. Pros. The only vaccine advanced to phase 3 clinical trial has shown only partial efficacy. Malaria transmission blocking vaccine targeting sexual stages of the parasite reference and ideal intervention to reduce the burden of the disease by controlling vector-mediated transmission and eventual elimination. Cons. Immunity against sexual staged antigens impair the development of parasites inside the mosquitoes, thus curtailing the transmission.
After almost 30 years of research and millions of dollars, malaria may soon get a final shot in the arm. European regulators have now given the green light to the vaccine known as Mosquirix, or RTSS, a drug developed by GlaxoSmithKline, partly funded by the Bill and Melinda Gates Foundation.
The trials have been conducted in 7 different countries in sub-Saharan Africa and involve 13,000 children. The children in the trial will have, for example, those influenza bed nets, and they will have access to the best healthcare if they get sick. So the vaccine is really an additional tool on the gold standard of care.
The vaccine works by stopping the malarial parasite maturing and multiplying in the liver, after which it would normally enter the patient's bloodstream and trigger the disease symptoms. But the trials are already raising questions over the drug's effectiveness. Results showed the vaccine was most effective in children between 5 and 17 months, cutting the number of malaria cases by nearly half. In babies up to 3 months, though, that dropped by 27%, with the protection wearing off over time and with a need for booster shots.
It is only a quarter of the people, or a third of the people will be protected. So will that benefit be enough is the question. And the booster doses could be done, but will they be cost effective in particular different situations in order to reduce malaria, or will other tools against malaria be more cost effective?
This is nevertheless a first big step towards the vaccine, and this could be a game changer in Africa, where there have been 198 million cases of malaria and an estimated 584,000 deaths in 2013, mostly among children. Now it's up to the World Health Organization to give its stamp of approval.
We believe that this is an additional, it's not the only answer, but it's an additional to help tackle one of the world's busiest killers and infectious diseases.
Isa Suarez, CNN, London.
Conclusion: molecular epidemiological studies not only allow estimation of a vaccine efficacy to be understood in the context of vaccine incidence and less frequencies. They also provide that to aid the ration the scene of malaria vaccine, having the kinds of information from endemic areas where vaccine will be tested and deployed will permit vaccine developers to choose.
Welcome Health News. The World Health Organization says the number of malaria cases worldwide has dropped sharply in recent years. In a new report released on Tuesday, the WHO said cases in countries outside of Africa have dropped by about half in the last 15 years. Africa, where the vast majority of malaria cases and deaths are reported, has seen slower but still significant declines of 32% since 2000. The WHO aims to wipe out malaria by 2040 despite not having an effective vaccine for it and increasing resistance problems to both drugs and insecticides used to kill mosquitoes. Malaria, which has killed more than 430,000 people globally this year, is a mosquito-borne parasitic disease that mostly strikes young children.
Thank you. Bye.